What can we learn from medical humanities and narratives is such a broad question. I think I would like to break it down into 3 elements. One is understanding how others are in the context of their lives. Often when we look at stories that transpose time, we can really connect with them. It's the experience of the connection and the interpretation that people who work in health can then use to understand how they are with patients. So it's how patients are in the context of their lives. The second is how you are in your own life and how you can develop your own personal narrative and your story of self. And the third is how we are within systems. So as well as working with patients and ourselves, how is it that the system starts to be defined by the social constructs that we say are most important, the ideologies, the way of transmitting knowledge, that kind of thing. And if we can understand those vicariously and then discuss it, we may be able to influence how we are with patients, with ourselves and with the system. My doctorate was looking at how we use poetry and prose to teach medicine. I was challenging the epistemological basis of how we think and how we do that. And I think now the time has come for me to take all of that studies and learning and connect it with not only what I do with NHS England, but how we can support recruitment of the workforce, resilience of the workforce and retention of the workforce using the humanities. I think the first step where we can use the humanities to influence healthcare policy and practice is put it in a framework that I've used from public health and from education before. And that framework has 5 elements. The first 2 elements have been using humanities to date quite a lot. So that's developing personal skills, whether we're talking about empathy and resilience, and creating a supportive environment. Those are 2 areas that support health development that humanities has worked with. What we haven't done yet is reorientating health services and developing public policy. So how we get there is identify to policymakers that there's this step-by-step approach, and humanities has worked and been used in the other areas from individual to society and creating community skills. And these are just the 2 other elements now that can embed the changes that we need in health to make sure that people do adapt their behaviour and manage health in the context of their lives in a way that policymakers want to work. So it's taking that whole health for all framework and sharing that with the policymakers so that they can see that this is part of normal ways of developing a paradigm, really. We were talking today about the use of humanities in terms of the retention and recruitment of the healthcare workforce. And what came to the fore were 3 things again. The system is ultimately designed at the moment to bring in people who have decided what they want to do with their lives, want to work full-time and will be doing that profession or job for the rest of their lives. That's how the system's designed, but the people who are coming in aren't like that. The other is that once people are in the system, their resilience is thwarted because the system processes them in a certain way, and it doesn't necessarily tap into their vocation or their emotional needs that are necessary in order to cope with the workload and the patients with such needs. And the third then is the tension between those. How do we balance vocation and system to ensure that we are fit for purpose for the 21st century and the professions that we grow have an identity based on their values and what they do, rather than the structures in which they're forced to exist?